Hello, everyone. Opeyemi speaking. I'm a project manager on the HealthPro Nexus team, and we are so excited to share with you what we've been building in the past 9 weeks. Meet my creative and intelligent team members here. And this is the outline that will guide our presentation for today. Moving on to the problem statement. From our market research, the Canadian health system is confronted with a myriad of pressing issues, from population surge standing at approximately 39 million to over 20,000 health professionals retiring from the health workforce in the coming years as a result of increase in aging population. Now, this has led to a projected shortage of 60,000 healthcare professionals by the end of this year. Currently, the physician and patient ratio is 1 physician to 330 patients. About 4.6 million Canadians are without family doctors, and the average wait time is 22 hours. All this and more impede equitable access to essential care across the nation, and this has negatively impacted the health outcomes of Canadians. About 43% of 25,000 internationally educated health professionals, also known as IEHPs. I'll be using this acronym a lot, internationally educated health professionals, IEHPs, who can bridge the workforce gaps. They encounter several barriers integrating into the healthcare system, from the high cost of obtaining their license to the arduous licensing process, the lack of community and support, and the time frame. Now, where do we go from here? Would like to introduce to you our solution, HealthPro Nexus. It is a platform that provides IEHPs, internationally educated health professionals, access to information and community to facilitate their licensure and employment processes for a seamless transition into the workforce. We do that by providing them flexible, affordable, and personalized mentorship, access to job board, supportive community forum, up-to-date resources and information, and access to financial aid, knowing that this is one of the challenges they currently face in integrating into the system. We serve 4 categories of beneficiaries. The first is IEHPs, second is licensed professionals who can earn extra income while they provide mentorship services on our platform. They also experience reduced burnout when we're able to recruit more health workers into the space. Health organizations would also have access to a pool of qualified professionals. And then you and I, who make the Canadian population, we can achieve better health outcomes because now we have more physicians and patients to care for us. Moving on to the product demo, I would invite Grace to take us on a tour on the user journey on HealthPro Nexus. Thank you for listening.
Oh, thank you, for a fantastic opening. In the next few minutes, I'll be taking you through our product demo and our financials. Sarah lands in Canada from Dubai. She's a new immigrant. At the point of entry, she has been told about how HealthPro Nexus can help her transition seamlessly into the Canadian health system. She comes on our website, reads up about us, and decides to sign up. She signs up by inputting her credentials and also selects the category of user she is. In this case, she's a member. She chooses that category and she's redirected to a page where she provides profile information, such as her name, license status. In this case, Sarah is an unlicensed health practitioner in Canada, hence the reason she has come to HealthPro Nexus. And she also provides her address for more personalized services. Once Sarah does that, she's redirected to her dashboard, where she gets an overview of her profile, a bit of information about her experience and her education. She also has a dashboard to give her a bit of insight about her activities and some analytics on her activity on HealthPro Nexus. She moves on to the activity tab. In this case, if Sarah was an existing user, she can see activities and actions performed by her on HealthPro Nexus. She moves on to my post here. She can join the community forum, where she can ask questions, like comments, share insights and all that in the community forum. And then she also can move on to the booked sessions. Here she sees sessions she had booked with a mentor. In this case, HealthPro Nexus had matched her with Courtney. She sees a bit of information about Courtney. If she decides to book a mentorship session going forward, she goes to the book session page where she fills out the form. HealthPro Nexus has this information, matches her with a mentor, and she can see that information on her book session tab. She moves on to my library, where she can easily access resources that she has saved to her profile. In this case, she has access to a wide range of resources provided by HealthPro Nexus in the resources tab. And she can also filter this information to streamline the kind of resource she needs. Sarah can also move on to the Save Jobs page. Here she has access to jobs that she has saved that she wants to apply to. These jobs are posted on the job board by various health organizations onboarded by HealthPro Nexus, and she can filter this job to her preference and get results returned to her. Sarah can also move on to the settings page where she can update her profile, change her password. She can manage her payments. In this case, she can delete cards, add new payment cards. She can also see her subscription history. She also can upgrade her subscription from a monthly plan to a yearly plan if she decides to. She also has the option to cancel her and pause her subscription. And Sarah also has the choice to deactivate her account or delete her account. That'll bring me to the end of the product demo from Sarah's perspective. Sarah is a mentee in this case. I'll be moving on to our competitive analysis. Compared to our competitors in this space, HealthPro Nexus will be providing all the following services, from resources to financial aid. We plan to be the one-stop shop, the one-stop platform for IHPs in Canada. Moving on to our financials, for our revenue model, we're exploring 3 revenue sources, which is subscription fees from health organization and members, mentorship fees from one-on-one mentorship, and affiliate marketing and ads. For our pricing structure, health organizations will be paying $600 annually. We have members paying $84 annually or $10 monthly. And we also have 3 mentorship categories ranging from $200 to $1,000. For our long-term sustainability plan, we plan to onboard other health occupations. HealthPro Nexus is kicking off with physicians, nurses, and pharmacists. We'll also look into onboarding locally educated health professionals, exploring education and certification via partnerships with universities and health organizations. We also look into getting funding and grants to finance the licensing process for our members. From the following revenue sources, we are projecting a revenue of $3.2 million in 5 years, a net profit of $1.5 million, of at least $1.5 million, and our break-even point is at the 12th month. For impact, we hope to have, at the end of 5 years, cater to 4,000 internationally educated health professionals, mentored at least 2,000 IHPs, and also served at least 821 health organizations. So what's next for HealthPro Nexus? For our MVP, we are kicking off with 3 occupations. We'll also be kicking off with subscription and payments and going with 4 features for this for the MVP version of our product. For the self-onboard version, we'll have all categories of users, mentors, mentees, and health organizations self-onboard. We'll also introduce personalized schedules and calendars for all the users. We'll have in-app messaging. We'll also have analytics and insights and onboard other health occupations. For the technology phase, we'll be looking into blockchain technology, machine learning. Blockchain technology will help us authenticate and verify users on the platform, especially mentors who want to onboard on the platform. We also have machine learning to help with matching mentors with mentees and also matching mentors with jobs, mentees with jobs, and matching health organizations to skilled workers generally. We'll look into virtual reality, introducing our mobile app. We'll also look into education and certification via partnership with health organizations and universities and educational institutions across Canada. We'll also look into financial aid for our members. For our team challenges, we had time zone challenge because we had team members work from across North America and Africa. We had difficulties retrieving competitor data. The next slide shows a snapshot of the apps used during development and collaboration. We used these apps, and what's next for HealthPro Nexus? We want you to follow us on our Instagram page. You can also learn more about HealthPro Nexus on our website when we launch. Thank you for joining us, and yeah, we'll take your questions now. Thank you.
Hey, are we clapping or no? I believe we are clapping. Lots of great energy in the chat. Let's keep it up. So we're gonna go in alphabetical order from Z to A now. We're gonna start with Nohelia.
Sounds good. Thank you for that huge problem to solve. Really, really well needed. Honestly, congratulations for tackling this. A quick question around the business model. Can you just go back to your slide? I want to see, how are you charging people? Who are you charging and how?
We'll be charging members. So we have members who are IHPs who want to sign up on the platform. So those are the people who will be charging. We'll also be charging health organizations who want to post jobs and be matched to health practitioners. So that's our revenue model. Those are the people who will be charging.
And what the members, okay, can you clarify the value proposition for the members? Is it the subscription, the monthly one, right?
They have a monthly subscription and they also have the option to subscribe annually. So the annual subscription comes at a discount.
Okay, but
on screen, whoever is sharing, just put it on the screen of the revenue model so we see it. Thank you. Because I think they want to see numbers. If you could just put it there. Sorry, back to you.
I guess my question is, what does a member get out of it? So if I'm paying per monthly, why am I paying?
Okay, you're getting access. So as a member, when you sign up, you already have access to the job board and resources. So you have access to job, and then you have access to general mentorship. So we have the one-on-one mentorship, which is more personalized towards members, but we have general mentorship where members come on and just get educated by professionals already in the space. So you have mentorship, job board, as a member, and the community forum for support and resources too.
Sounds good. Okay, so my feedback to you would be that there's a lot you can actually do with the business model to make it a lot more scalable. In general, charging $10 per month per every member, you need critical mass to be able to make it scalable. I would encourage you to look into a recruitment business model, which entails essentially taking a commission out of another of the company or the organization, or getting the government to pay for the recruitment services that you're doing, which is a lot more lucrative and a lot more scalable and sustainable than doing a business model around very small monthly subscription fees, and also relying on mentorship or on grants, which can also be a precarious position if you were to do that. So that would be my general feedback.
Okay, thank you.
Thank you. All right, appreciate that, Nohela. Let's go to Ayodele.
Yeah, thank you. So first of all, great job, guys. I'm impressed with the quality of work that you guys have done in such a short space of time. Nohelia would have commented on the business model already. So one of the things I want to encourage you guys to do is when you're building products, is to be very clear about especially in the initial stages, it's so important to limit or narrow the value you want to provide for a specific user persona. Throughout the presentation, I was a little bit, it was difficult to follow at what point were you delivering value for members. And then, at other points, it came across as though your main, differentiators that you were targeting IEHPs. But then throughout the demo, I didn't see what that flow would look like for the IEHPs. So I wasn't very clear at some points throughout the presentation. But that said, I think it was an excellent job in terms of the user experience. Everything looks absolutely amazing. I think that's very important. One of the other concerns I had, and it was really in terms of the release schedule. I saw like really large gaps, between the release cycles. So I saw something like 9 months between each release, and a typical best practice is to have continuous releases as you build out these specific features and this specific value. You want to be able to release, because the lifeblood of building a product is feedback. So you don't want to build like 5, 6, massive features and then release them at once. One of the things you want is that continuous feedback and so forth. So that's the encouragement and feedback that I would provide.
Fantastic, thank you. And then last but not least, Aki.
Great. I echo Nohela's and Ayodele's views as well. So first, what I want to commend the team on is you've identified a problem, right? It's a relevant problem that we can all relate with or relate to. I like the quick introduction with the video from an expert to kind of just establish that, yeah, this is indeed a problem, not just in our minds, but the experts are also seeing it as a problem. A couple more things I wish you did more of was the data, right? Like the data was jarring, 1 physician to 333 patients, I think, and 22 hours wait time, right? Like making that evident, like putting it on your deck, right? I saw a few things on your deck, but sometimes having the data speak for you over some of the graphics and over some of the texts, I thought that could have been an opportunity to further reinforce the problem statement. I echo the thoughts of the other judges. It wasn't clear what the value proposition was. And I know a bunch of things were mentioned, but I couldn't come out of it with a clear sense that, yeah, this is what HealthPro Nexus is about. So perhaps streamlining that, working better to make it clear to the IHPs what the value proposition is, what exactly they get from what you hope they pay for. I think narrowing down that value proposition or making it clearer is an opportunity that you should take and work on going forward. I know the government, for example, Ontario Health, they have a team of people who help internationally trained professionals who want to be licensed in Ontario to transition in Ontario. How is HealthPro Nexus different from what the government offers, presumably for free, right? So just tightening up on your value proposition, I think, will be a great next step for the group. Thank you.
Thank you, judges. So we're gonna give the teams a minute to give their feedback. Previously, my Healthy Plate did not get a chance to provide their feedback, but they put it in the chat. So if you just scroll up a little bit, judges, after this one, to see that response to your feedback. So you will give you guys 1 minute to give a consolidated response, and I would encourage you to focus on responding with regards to the value prop as designed for the IEHPs and other questions that they may have asked. So who's going to go and provide the feedback?
Okay, yeah, I can speak on behalf of the team. Okay, so thank you so much, Akin, Ayodele, and Noela, for the feedback. We would also put into consideration some of your thoughts concerning the product. In terms of the specific value, we would also work on that to ensure to streamline the value so that we are able to clearly communicate it to our audience. And at least one major thing they get to benefit from our platform would be access to resources and information, up-to-date resources and information, and also personalized mentorship. So those are 2 features that we'll be focusing on for our MVP this period, and access to a job board. So these are features that we'll be focusing on this MVP, and then over time we can expand. Also, we'll be focusing on just 3 professionals: pharmacists, nurses, and physicians, as we need to also better understand the market and ensure that we have the right tools and resources to provide value to these people. Yeah, thank you.
Thank you very much.